Hey, good morning. I'm Dr. Steve Stites, Chief Medical Officer here at the University of Kansas Health System and Executive Vice Chancellor for the University of Kansas Medical Center. Welcome back to Open Mics with Dr. Stites. We are weeks away from the World Cup. Here's the map. It's coming to Kansas City. We will host a total of 6 matches and are planning for 650,000 visitors. University of Kansas Health System is an official supporter. The health system is the official medical services provider offering first aid to spectators at Kansas City Stadium, that's Arrowhead, during the World Cup. It's called Kansas City Stadium, during the tournament, and helping direct medical care, planning for visitors and fans in connection with FIFA and KC 2026. A lot of preparation has been building to this moment. Let's introduce our guests. We'll have Dr. Brian Beaver with Emergency Medicine here at KU. He's the KC 2026 Host City Health and Medical Lead. That's a lot of words. I could sort of do it. Andy Marshall is the Health System's Emergency Preparedness Manager, and Adam Olberding, who is the Senior Director of Nursing and working extensively on hospital preparation across the region for the World Cup. Also joining us, Dr. Dana Hawkinson. He is Medical Director of Infection Prevention Control, a familiar face on the show. And finally, Dr. Kirk McCullough joins us from the Kansas City Orthopedic Institute. He's been named the FIFA Venue Medical Officer for the 2026 World Cup Kansas City. Thank you all for everyone being here. I think the show should be over. That was all too many words on that introduction, but I'm glad you guys are all here. All right, Dr. Beaver, we're going to start with you. When you think about the scale of the World Cup, what kind of medical emergencies are hospitals planning for, and how different is that from a typical large event, and can you get me tickets?
The tickets, no. That is not in my purview, unfortunately. I wish. But as far as the scale, obviously this is a bigger. This is going to be a bigger event. It's the largest sporting event in the world, bigger than anything Kansas City's ever seen. And so, you know, a lot of work has gone in. But when we look at it from a standpoint of other similar prior World Cups, Olympics, events like that, you know, thankfully, most of the illness that we see from folks coming in is mostly minor illness and injury, not a lot of lengthy inpatient hospital stays. We're certainly preparing for that. We're preparing for everything, you know, that could possibly happen, but thankfully, mostly minor illness and injury that we're expecting.
And I've heard that Kansas City is more ahead than anybody at being prepared for this, and that our teams have done the best job of anybody in the country. You think that's true?
I know that we've done a lot of work together, and I think the thing that makes us unique is that the Midwestern collaboration that we have here, and people willing to work together across health system lines, EMS lines, state lines. That's been a huge asset for us in Kansas City, being able to get ready for this World Cup.
Okay, well, let's roll, Kansas City. Dr. McCullough, from an orthopedic standpoint, what are the most common injuries you expect to see from these elite athletes, from the elite athletes to everyday fans?
Yeah, I mean, you know, so the biggest thing with soccer that we end up seeing is lower extremity soft tissue injuries. You know, with all these delegations traveling from a lot of different climates, traveling thousands of miles, you know, one of the biggest issues with the amount of volume that they run and the exposure that they have is just to those soft tissue injuries. I think the complex lower extremity or upper extremity injuries are going to be rarities. We will be prepared for them, but certainly the overuse soft tissue stuff will be the biggest issue. As it relates to fans, I think the biggest thing we need to just be ready and willing for is, like with any other visitors, the interesting thing is just going to be for those that may end up unfortunately finding themselves overserved. Any of the ground level type falls, twists on the extremities, e-scooters, e-bikes, that's what we're going to probably see from them.
So what I hear you saying is be careful with drinking unless it's water, stay hydrated with that, and watch out for the heat, and don't climb onto the field with Messi.
Yes, absolutely.
Excellent plan. All right, Dr. Hawkinson, we'll have visitors from all over the world. Are we preparing for any kind of infectious disease? I don't think there's anything out there right now. I don't see new bugs jumping across the pond, but what do you think? What's on your radar?
Yeah, I think you're exactly right. I think, first of all, we start, yes, with the are there any particular diseases? Well, we know there's always some small outbreaks in communities around the world in different endemic diseases to those places of the world. Now, obviously, here in the United States, in our different cities and communities, and even in other places in North America where the World Cup games are being held, there will be travelers from all over the world, whether that is the travelers from the home country of those teams or travelers who are living in another country still traveling to follow their original host teams or their country's teams. So they will be in those other communities around the world where there could be different endemic diseases. So yes, we are always preparing for them. We are preparing, just as we heard, as a collaborative around the region with all of our regional states. We are preparing in our city, in our community, with all of the government agencies as well as the other healthcare institutions to do that. And especially we are preparing here at our institution as well. We know that for more than a decade now, we have had systems and processes in place to deal with infections of high consequence. We are still working through those, evolving them, creating the most streamlined processes and systems to keep patients, their families, and our employees safe. So yes, we are fully aware of those. We are waiting for those. Hopefully they don't happen. Hopefully we have very minor, if any, health needs whatsoever during the summer. But if we do realize and see that we have some, we will be ready.
Andy, what would surprise most people about the level of preparation happening right now behind the scenes? And just to say, you've dealt with a lot of emergencies in your life. You've been here in KU and Kansas City for a while, and this is your gig, this kind of big preparation planning and stuff.
Yeah, I mean, I really think the big thing, and Dr. Beavers and Hawkinson both kind of touched on it, it's the collaboration. We have been able to pull together hospitals, health systems, EMS agencies, public health, state, federal, local partners. Everybody is coming together, working to plan and prepare for it. And we've kind of always said that our planning, we want to do all this planning, and we don't want anybody to know about it. We want to make sure that at a regional level, we have the capability to ensure that everyone is able to receive medical care, whether they're a citizen living here and a resident of Kansas City, visiting from somewhere else in the country, or international visitors. We want to make sure that everyone has a fun time, but if they need medical, we're here. And if something worse happens and it goes into more of the emergency management preparedness world, we also have plans ready for those.
You know, I love that level of preparation, and I love the constant message around Kansas City is we're all working together, which really is an important deal. It's kind of how it felt during the pandemic for us. I think we quit thinking of ourselves as KU and St. Luke's and HCA and Shawnee Mission or whatever. We sort of started thinking of ourselves as Kansas City and how do we make sure we get all our patients taken care of. We're trying to get the word out between the difference between an emergency department and urgent care and how healthcare works in the United States. And we're going to be posting social media videos. Here's just one of those videos.
This summer's World Cup is taking place in 16 different cities and 3 countries across North America, including right here in Kansas City. I'm Dr. Brian Beaver, an emergency medicine specialist. I have some important tips for action you should take before you begin your travel. First, refill any prescription medication to ensure you have a supply that will last for the duration of your trip. Keep medications in their original labeled containers that show your full name, healthcare provider's name, generic and brand name, and exact dosage. Keep your important medical information stored on your mobile device. Include a list of your medications, allergies, and medical history. Also, provide an emergency contact. This will help medical personnel assist you if you become sick or are unable to speak. Remember, 911 is the emergency number for the United States, Canada, and Mexico. When you are traveling by air, keep all medications in a carry-on piece of luggage. You'll need it if your flight is delayed or your luggage is lost. The same goes for medical devices. Remember to bring the right power adapter for electricity. The USA, Canada, and Mexico use the same system. But you may need a 3 to 2-prong adapter if you're staying in older buildings. Lastly, consider a travel insurance policy. It is a great idea in the case of an unexpected medical need or emergency.
I love that. Question is, were you truly standing at the airport in a white coat?
I will say thank you to our KU Media folks for doing a great job of editing on that.
Well done. I like that. That's the right answer. Okay, Adam, how will we handle all the language barriers? I know we have a lot of different patients with different types of languages and are coming speaking different languages in the ER all the time, but how are we going to handle it on this international basis?
Well, we do know the teams that are coming to town, right? So we've prepped with extra interpreters there. We've added iPads in the emergency department. We've got Propio on the phones in the emergency department, and then we put
Propio is a language translator.
It is a language translator. Yep. Yeah, it's an app for that, and the nurses are used to using that on the patients that come in now. The physicians can use that, and then we added iPads out at the at GIHA Stadium or wherever. we're
Kansas City
playing.
Stadium. That's the one.
Yep.
Yeehaw
Yep.
Field. Oh, it's not a Yeehaw Field, right? It's Kansas City Stadium. Okay, well, live long and prosper. What we really need are universal translators.
Yes.
But I guess until we get those, we have all these other devices.
Beam me up, right?
Yeah, beam me up, Scotty. All right, maybe in the middle of the traffic of the World Cup. Scotty, beam me over to Kansas City Stadium. Dr. McCullough, as FIFA venue medical officer, what are you going to be doing from the sideline? Talk to us a little bit about your preparation. What do you anticipate as being medical needs from the teams? And I have a really big question for you. Are those guys hurt, or are they just taking a break when they go down?
Yeah, so, obviously there's a lot of drama as it relates to some of that. So, the FIFA match doctor and obviously those being able to sort through what's the fanfare or the drama compared to the real is always certainly a challenge. But, for the preparation that we're doing for the sidelines, I mean, the great thing about, Kansas City Stadium, Arrowhead Stadium is the long-standing nature of the University of Kansas and medical teams' relationships. Certainly, there's been a lot of exposure with the success of our American football team there. So plenty of highly, populated, highly attended events that with a large exposure, maybe not to the same degree of the World Cup, but with the interaction that Dr. Beaver, the University of Kansas physicians, and Fire EMS have had, now all it simply is just incorporating that into the longstanding FIFA protocol as it relates to how they manage medical issues. And our FIFA match doctor, George Oman, who will be at every single game, it's a matter of getting us integrated into that system so that can be a seamless transition between what FIFA's expectations are, what's been a longstanding provision of care there at Kansas City Stadium, and then just making sure that those teams are working seamlessly. So Dr. Beaver and I working together with coordinating with local fire and EMS with the FIFA group and doing that. It's been largely just making sure that everyone's on the same page.
Yeah, I think that's such a great story, that coordination, different groups, everything. That's so good, putting all that, the care of the patient first. Now, Andy, how do you coordinate across local emergencies, EMS, public safety, and even federal agencies to make sure everyone is operating from the same plan in case of an emergency?
Yeah, unfortunately, Kansas City is no. We have had some emergencies in Kansas City. So
we've had a few. There have been some tornadoes.
Yeah,
and
we've
some
had
other
lots of
bad
different.
things,
Yeah, lots of different things. So luckily, when we kind of went out on this journey, we started with what already existed. So we already had regional groups that were meeting, discussing, and planning for emergencies. So pulling all of those groups together, then scaling it up. So I mean, we basically did very similar plans for World Series parades, Super Bowl parades. One of those, unfortunately, did turn into an emergency.
Unfortunately, we needed that help that one time.
So taking all of those, we've had plans, we've had some lessons learned, we've learned and grown from those, and then we just scaled it up for World Cup, making sure that everybody is on the same page. We will have an extensive coordination system and communication with different regional command centers. Everybody will be talking to each other. There's kind of single point contact for anybody during an emergency, so we can relay that information as needed.
Now, Dr. Beaver, how is this different from a typical Chiefs game or concert? And by the way, those pictures of Arrowhead, I still call it home.
Well, the biggest thing that fans will see at the stadium is the footprint is going to be different. It will extend out into the parking lot, into the secure area. There's going to be some great activities for fans to be able to do out there before and after the matches. And so with that, we've had to make some additional, planning preparations to add some additional staff, add some additional first aid spaces outside the stadium that we might not normally have for a Chiefs game. But fortunately for us, we've been covering that stadium for many, many years now. And so as Dr. McCullough mentioned, it's just been a matter of taking what we've been doing for many years, marrying that to exactly what FIFA wants, and putting the whole picture together so we can be well prepared.
I love that, and that picture down there of Arrowhead going across the beds. You're like, I don't really think about Arrowhead as having hospital beds in it, but indeed it does.
It does, yeah, we do.
All right, now we have a lot of international visitors as well, and EMS teams are preparing for the language barriers, different medical histories or unfamiliar conditions, things that maybe we don't encounter every day here in Kansas City. Talk to us about how you go about doing that.
Absolutely. So fortunately, with that collaboration, we've had every single EMS agency in the entire region at the table, meeting together, working together, collaborating. So many of our EMS agencies are adding extra units during specific periods when we know we're going to have an increased population. You know, our goal for our residents who live here every day is that even if somehow they didn't know the World Cup was going on and they need to call 911, they still wouldn't even know, because it's not going to impact the care that they receive. It's not going to impact the time of the response. So we've put a lot of work into that. We do have on our ambulances mobile translation devices that can be used. So if we are working with an international visitor, we're able to do that. And then, you know, along with what Dr. Hawkinson was discussing, we are fortunately able to get a lot of input from both of our state public health agencies, our regional, local public health agencies, and then the federal government has also helped push out to us things that we're getting throughout the region to make sure everyone's aware of anything that might be a little bit unique that we don't see every day here in Kansas City.
Awesome. Let's roll Kansas City, right? That is great, great stuff. And Lawrence with Algeria. I mean, they've got something going on out there too. And Hawkeye, talk to us a little bit. I mean, you and I work together a lot with regional hospitals and states and things like that, and internationally with China and other places during COVID. Does this feel familiar to you?
Oh, it certainly does. And, you know, what I would say to the point that we've just heard about the regional collaboration, you know, we just did with infectious disease and IPAC. We just did a tabletop exercise with 6 or 7 other states in our region that was put on by the National Special Pathogens Unit. So again, that collaboration continues to grow and hopefully smooth out any rough edges that we need so that we can run a good system. But as far as overall, yeah, it certainly feels like it did in the past, but hopefully there won't be any of that actual illness that we need or we see during this this tournament and this great thing where everybody is coming together. So.
Well, and of course, we know that the rules and the pillars of infection control travel with you wherever you go and help keep you safe.
Yeah, so we would, you know, we've heard questions like, what do we do? How do we stay safe in all these crowds? You know, I think the best thing is, just like you said, those pillars of infection control. Number one, know that situation you're in. Where are you going? Obviously, you may not know a lot of those people, but are you going to be indoors or out? Luckily, for the World Cup, it is going to be mostly outdoors in those things. Obviously, people will go probably to bars and indoor places to watch it, but the venues are really going to be outdoors. Great space, great just airflow, air ventilation. Also, if you are sick, try not to go out. We know it gets more difficult. It is harder when you're here for a game and you want to go to that game. Also, always the most important thing, I think, is continue to do adequate hand hygiene with either hand soap and water or the alcohol gel. That is going to keep you safe, and try to stop from putting your hands in your eyes, your nose, your mouth, especially when you're out at those venues and touching on those all those high touch surfaces. That's probably going to be the biggest way that you're going to encounter an infectious disease.
All right, well, the other thing we're going to encounter is heat and humidity. I know you guys are, at least it is July in Kansas City. All right, we're here to answer your questions. Send them using the links on your screen: YouTube, Facebook, email, the Medical News Network. Let's check in again with Doc Hawk as we continue to discuss World Cup. Hawkeye, how important is coordination among state and local agencies for events like this? And again, we've done this a little bit before, but what are you thinking?
Yeah, so again, we mentioned that we are in coordination. Why is that important? Because, you know, mostly because there are areas set up, there are health institutions and regions set up for if you have something, you know, heaven forbid we have something like Ebola, but that seems to be kind of the prototype of what we are really thinking about here. So we do have those places set up in those regions. Not every place is designated to take care of Ebola patients. We call those really just infections of a high consequence, but we're using that as an example. So we have to coordinate with areas around, not only because of where is that patient going to be, how are they going to be treated, but as you are now transporting a patient to a national treatment center like they have up in Nebraska, what are all those state rules and transport? And so it's very significant and important to coordinate with all those state and local entities to make sure everything runs smoothly. So that is the biggest thing, is just continuing to to have that open conversation and really evolve all of those processes so the patient has a good outcome and we keep everybody else around us safe as well.
And remember to keep wearing sunscreen, because otherwise you get to visit a dermatologist like I did, and instead of being able to say, I was playing soccer with Messi, you have to say, I got zapped in the dermatologist's office. So wear your sunscreen when you're out there, folks. Don't ever forget that. Hawk, are there anything you're keeping an eye on out there? I'm not really seeing any. COVID's quiet, influenza's calmed down. To your point, hopefully we're in a pretty good window.
Yeah, I think that's exactly right. So we're out of respiratory viral season now. That is a good thing. We aren't really tracking anything too much. We were trying to get some coordination. I know there are some groups or entities tracking wastewater data. That'll be interesting to see what they actually show. How real time is that going to be? It's going to be difficult because we know when you do find it in the wastewater, it's probably already in the community. But I don't know that will aid too much in the actual real-time diagnosis and treatment of a disease, but it will be important to see what maybe that tracking of those entities, whether that's viral, bacterial pathogens in the wastewater is. But as far as active infections, really, luckily, nothing too much. Obviously, you said sunscreen. We also want visitors to our communities to wear adequate insect repellent, because we know mosquitoes can be very bad. Really, mosquitoes around here, the only disease they really carry is West Nile virus. And if people are out enjoying nature around our communities, visitors walking on paths and trails, it's important to wear that bug spray as well to keep those ticks off. We know ticks can spread a few diseases. But other than that, it's really kind of all cool on the Western Front at this point, but we'll certainly keep an eye on everything as we move forward.
There's one other pathogen we have to talk about, and people know and experience in Kansas City. What's that one little bug we all hate that are in the ground? It can itch forever. Chiggers. Yeah, we all said it once. We didn't prepare for that. That's pretty good.
Very itchy, but luckily no spread
Not
of disease
infectious,
from those.
but will make you miserable for a while,
Yeah.
and they love belt lines.
Yeah,
Okay,
they do.
we know that many of you have questions, hopefully not about chiggers. Let's head to Studio B with Alexis.
We have a question from Jeremy. Jeremy writes, hosting the World Cup in Kansas City is unique because it's hosted in two cities, KCK and KCMO. Was it easier or harder to prepare for this since it involved both Kansas and Missouri?
That's a great question. I would extend it even into Lawrence, too, because of Algeria.
Yep.
So what do y'all think? Was it easier or harder?
Well, we've been pulling every hospital together every other week for months now, so that we can coordinate what our capacity is, what our staffing is, working with our EMS partners. So I don't know that it was necessarily easier or harder, but we have been doing something that we've never done before and pulling the groups together to focus on one singular event that's bringing the city together.
Yeah, that is pretty cool. Because even COVID brought us together, but it wasn't one single event. It was more like this prolonged arc of agony or whatever.
Yeah.
But years we go.
Lost my hair during it.
And not as much. Well, yeah, okay, you and me both. And not as much fun as the World Cup either. I'm just going to say. Are you going to go to some of the fan fests?
I will probably hit one fan fest.
Yeah. Who's your team?
Algeria.
I wonder
they're
about
kind of
that
the underdog.
too. They're the underdog.
Yeah.
Okay. Well, you guys ought to get prepared for that question, so I'm coming to everybody else. Okay. Alexis, back to you.
We have a medical question. This is from Becca. Becca wants to know from Dr. McCullough, when do you know if a sprain or a twist of an ankle needs medical attention, or when do you know it just needs ice?
That's a pretty good question.
Yeah, so, a lot of times it's going to be the ability to bear weight. So if you can bear weight on it, even if there is some swelling, most of the time we will think of that as a sprain. That's not universally true all the time, but if it is significantly difficult to put weight, if you can't get weight on your toes and your heel, and that's something that persists beyond just the initial shock of the injury, arguably most of the time that's a consideration, at least to get an x-ray. But sometimes it's just a matter of letting the dust settle, the shock of the initial injury, and trying to compress and ice. But that inability to bear weight becomes my initial concern.
We have a question from Kathy about alcohol consumption. We know a lot of people like drinking before, during, and after watching sports events. She wants to know if alcohol is going to be limited. And also, we have other questions from viewers just wanting to know how that will be handled with people expected to be drinking more during this time.
All right. Kirk, Dr. McCullough, what are the rules for drinking at the World Cup games? Does FIFA have rules?
Yeah, I mean, Dr. Beaver, you can answer this as well. I mean, as far as, around the venues, obviously there will be considerations as it relates to venue-specific things, to the Fan Fest-related things. I mean, we've all heard about even some of the local jurisdictions leaving bars open much later than we normally have. So, look, I think the question as far as the exposure risk, and even as I brought up, as far as people being overserved or inebriated and getting injuries, is real. But as far as actual FIFA mandates, we've even seen some that have been going back and forth about whether or not they're going to allow the tailgate. I mean, those concerns are real, but I think FIFA tries to let the local jurisdictions kind of weigh in on that more than what they want to be heavy-handed on.
Mm-hmm. Thoughts?
Yeah, I mean, the reality is most of our events that we cover at the stadium, alcohol is served. And so we have plans in place to be prepared for any fans that might be overserved, on what we need to do to make sure we keep them safe, number one, and then find where's the safe place for them to go, whether that's back home with a friend or family member, or if they're too sick and we need to sober them up a little bit more, have options to do that. So alcohol is always something that in event medicine planning, we always take it into account. It's a factor that can drastically change the number of patients that you see. So whatever alcohol consumption there is, I'm confident we'll be prepared for it.
My guess is it's not going to be worse than it is in some of the Chiefs games. It's just a thought, especially with the clear tailgating that is such an event at Arrowhead.
Yeah, I would not expect it to be worse for sure than a Chiefs game.
All right. Alexis.
Jackie wants to know, if something goes wrong at a game or a fan event, how confident are people that our local hospitals can handle it?
Oh, I think we're confident.
Very confident.
Yeah. Adam spent a lot of work on this, so.
Yeah, I mean, regardless of where they get transported to, the EMS agencies have committed to getting the patients to the right hospital the first time. And the hospital's been prepping their emergency preparedness plans, as well as increasing staffing during game days, 2 days after, a game before. I'm 100% confident that if something happens at the stadium, if they cannot be taken care of in the stadium, because we do have a great medical team taking care of the patients and the fans in the stadium, when they go to the hospital, it'll be just fine.
And there's like a 6 to 7% projected rise in hospital census, which we can handle that. I mean, it's not perfect. We can do that. That's all right. Yeah. Okay, this has been a great discussion, and I'm really grateful for our guests for being here. I know you guys are all busy. There's a lot of work to be done. I do want to hear some final thoughts before we go. And in your final thought, I also want to hear who, and I know some of you may not be able to say, but do you have a team that you're cheering for? Dr. Beaver.
I'm not sure if I can say if I'm cheering for a team or not, so I'm going to err on the side of not choosing a team at this point. But
the Chiefs.
Yeah, the Chiefs.
Royals.
That'll be safe always.
The current.
Yeah, no, we're excited. We are excited to have all these visitors coming in. We're excited for Kansas City. I'm very proud of Kansas City and the region and the work that we've been able to do to prep this. And, my final thought would just be a huge thank you to these folks sitting at this table, Dr. McCullough. We've had an incredible team working on this regionally. There's no way that any one of us could ever prepare and be ready to do this. And so I'm really thankful for the team that we've had across this entire region working together.
I think that's awesome. All right, Andy.
All right, I'm going to have to say Team USA.
Yeah,
I know they're probably not a favorite in the tournament, but got to rep the home team. I think big thing for me is, the fact that Kansas City was even able to pull off getting the World Cup. We are the smallest host city. We have the most base camp teams that are going to be living here throughout the tournament.
Yeah, that's cool.
We, 5 years ago, never would have believed this was an option. And not only are we doing it and we got selected, we have been able to plan, prepare, and somewhat excel at being ready for everyone to come in, enjoy the tournament, and hopefully they won't need to see a lot of the medical teams.
I love that. We hope that they don't, and we hope that they don't. All right, Adam.
I will echo a lot of what Dr. Beaver said and just expand slightly into the appreciation for every healthcare community member that has stepped up during this and has made it possible. I think that we're going to be successful because everybody got on the same page, but this is going to continue post the World Cup, so the patients and the people of Kansas City, I think, are going to benefit for this for years to come just by the collaboration that's going on right now.
It's been a great story. All right, Dr. McCullough.
Yeah, so team-wise, as a physician for U.S. Soccer, I've got to pull for them, regardless of what some think the chances are. To echo the sentiments of everyone else, I think the collaborative effort here is critical. What we've been able to accomplish in the planning and what I know we will accomplish in working together to do that, I think is critical. I appreciate how the University of Kansas has taken the lead as the host city medical sponsor in trying to help these people coming to our region to understand what we're about and what we can offer. And once again, whether it's the people that have volunteered now or even empowering the people that are watching this or that are getting excited about it, this is an opportunity for us on the world stage to be able to show what that Midwest feel is like. And I would empower and encourage everyone to extend that hand and welcome these people, provide them the support that we're trying to do from a medical standpoint, from just a society standpoint. And it's just a great, very unique, once-in-a-lifetime opportunity for us to be able to make that statement to the world.
Yeah, that is so. Isn't that important? Because we are talking to the world during the World Cup. That's a pretty cool thought. Doc Hawk.
Yeah, I think I'll just echo that statement. Just kind of from a society and a humanity standpoint, just extending that hand and having everybody enjoy a good time here in the United States, in North America, and of course specifically here in Kansas City. As far as the football, I think I'm not rooting for one particular team other than obviously Team USA, but just hoping for some good football being played in these next few weeks, or as the tournament starts in those next few weeks.
Yeah, great stuff. All right, well, let's check in with Alexis Delcid one more time with a look at all things heart for tomorrow. Alexis.
Thank you, Dr. Stites. And tomorrow we're talking about a very buzzworthy topic, inflammation. You hear that word all the time. It's the body's natural response to injury and infection. We know it has a lot to do with arthritis, but doctors have also learned it's a contributing factor to many other diseases like diabetes, cancer, and heart disease. You'll hear from the experts on the newest research and what works to reduce inflammation. That's tomorrow morning on All Things Heart at 8 a.m.
What a great thing. I should probably listen to that program tomorrow on All Things Heart.
Come visit us.
I might have to.
Make a cameo.
Cameo, yeah. I won't have time to put on the makeup. I'm not sure I could do that. This is a cool opportunity. I have to say, I kind of get goosebumps thinking about it and thinking about how wonderful it is for our city and for us to have a chance to show the world the heart of Kansas City. And I know all the hearts are going to be out, but all these teams here to practice and get ready, and then the actual games. But what I think is really the best part about Kansas City is our heart, and my only encouragement is to make sure people see your glad heart from all over the world. Because if Kansas City shows its glad heart, as we have so many of their time, and welcomes the world to our home, I think we're going to have a really great time. And what's that they like to say at the current games? Kansas City, baby. Let's go. Let's roll. All right. Thanks again to all of our guests. Remember, faith, hope, science, and a glad heart. We'll see you soon.
Subscribe to our morning medical update and open mics with Dr. Stites podcasts. Now everywhere podcasts are available.